So we are the J-Sei Case Managers.
This is Miyuki Iwata. I'm full-time J-Sei Case Manager. Thank you very much for participating today.
And my name is Veta, and I have had the privilege of working with J-Sei for most of the past 10 years. So the impetus for this presentation actually comes from you, our clients. One of the big questions many of you have asked us is in regard to consideration of living options as we age. Do I continue living at home? And what does that mean? Do I move somewhere else? If so, where? And what are the options? We will address these concerns the best we are able. There will be a Q&A after our presentation, and Jill will forward the questions to us, or however Jill wants to do that. So to start, maybe we're not ready to make these decisions now. Good, because that is the time to think about your options. So what will your options be? So when you do need or want to make this very important, difficult decision for you or a loved one, you have some information and can afford an uninformed and say, oh my gosh, I gotta do it now response. One option may be aging in place, meaning staying in your own home or moving in with a family member. Some things to consider. Eventually, will you need more assistance than family can provide? Will you need caregivers? J-Sei does have a caregiver referral service, and we also have agency that we can refer you to. Are there mobility issues? Are there exterior or interior stairs to navigate? Is lighting adequate as vision may change? Is access to the bathroom convenient from the bedroom to the living room? What home modifications will be required for you to stay safely at home? And there may be tasks for you that you are unable to perform, like paying bills, arranging for, and getting to medical appointments. In that case, you might want to consider hiring personal assistants to navigate some of those daily tasks. Very important. Will you be isolated? There's not a lot of family or friends visiting, and your ability to get out and interact with others limited. If your home is meeting your needs as you age and need more care, if you have sufficient care, and if you are not quite isolated, then in fact staying at home may be the best option, or maybe it is not the best option. And before we start talking about some different options, I want to mention that everything about this is expensive. Whether you stay at home and you're hiring caregivers, or whether you are moving to another community, which we'll discuss. If financing is a concern, some options include, do you have long-term care insurance? Miyuki's going to be talking about that in a minute. Maybe refinancing your home. Is a reverse mortgage viable? We can offer you to a reliable source that will provide free consultation for reverse mortgages. Just saying that all of these options that you'll hear today are expensive. Aging in this country with any kind of care needs is not an inexpensive issue. Are we doing, what's the next slide?
Oh, I didn't even start.
I'm sorry. We're doing aging in place? We're getting there, folks. What do you have as next? I don't have them.
So you spoke to the way to start home, right? So next is home share.
Home share isn't.
You finished?
Stay at home is next. Home share, please.
Yes. Home share.
Yeah.
Okay. So yeah, home share. For home share, I'm going to talk about the home share. There are so many new and existing ways to live these days. Home sharing is one creative and innovative new way to live. Home sharing helps the homeowner get some extra money and helps the renter find comfortable, affordable housing. Finances are not only one benefit of home sharing. Other reasons for home sharing: build community, companionship, friendship, have meals together, share chores from gardening to maintenance. It is also nice having somebody around in case of emergency. As a homeowner, you can release rent in exchange for home maintenance. So if you are an empty nest or looking for a nest, you may want to consider home sharing. How to find housemate? How to find housemate? You can find housemate by using your own network, but there are several online home sharing websites that provide house sharing matchmaking service for seniors. There are some websites you can see COVID community service, home match, senior house share, silver nest. I'm going to talk about long-term care insurance. Long-term care insurance helps cover the cost of long-term care service, such as in an assisted living facility. Other places where a long-term care policy will reimburse you include an adult daycare center, a nursing home, and a caregiver at your own home. Typically, health insurance doesn't cover these types of costs. In general, eligibility starts when you can no longer perform independently 2 of the 6 activities of daily living. It's called ADL, such as eating, bathing, toileting, transferring in out of bed, chair, walking, dressing. Policy may pay up to a daily limit with a maximum lifetime limit as the cap. Remember, long-term care coverage doesn't pay for everything. It's designed for custodial care, not medical care cost. The rate you pay for the policy will depend on multiple factors, including your age, marital status, gender, health, coverage level, and insurer. Some websites state that ideal time to buy long-term care insurance is in your 40s to mid-50s. While some websites state if you are healthy, somewhere between age 50 and 65 is generally the most cost-effective time to buy. The younger you are, the lower the cost. But if you purchase too early, you will be paying premium for a long period of time. As you get older, by comparison, visits to the doctor office may result in new diagnosis, new health problem, and prescriptions that can easier cause you to pay more for long-term care insurance or make you completely uninsurable. Consider if you can afford to pay for long-term care insurance monthly premium for long term. You can talk to your financial advisor also. If you have long-term care insurance already, you can also talk to high cap counselor if you have any question about your long-term insurance policy. High cap information you can see that on the screen. So Veta will talk about retirement community.
Okay.
before I do that, I left something out that I just wanted to mention. So if you don't have long-term care insurance, or even if you do, if you're planning on staying in your home and finances are a problem, you might want to think of refinancing your home, or a reverse mortgage may be viable. And we can refer you to a reliable source, actually from the J-Sei participants, that will provide free consultation for reverse mortgages. So we just wanted to give you some of those resources that are possible. So what are the other options besides aging in place and home share? First, a general statement. All residencies must be state licensed. All usually provide some level of housekeeping, congregate meals, and an emergency response device located in each dwelling. All are designed to feel like home because they will be your home. Each place has a different ambience, a different feeling, a different environment. Some are more formal, some are more casual. They differ in size to pretty large to some small homes. That is why it is advisable to do some investigating before it is time for the decision to move. Later, we'll give you some suggestions on how to do this investigating. I have had clients who visited a number of alternatives for 1 to 2 years before they actually decided to move, or before it was time for their loved one to move. In general, all communities have a daily calendar, which includes the menu, any special activities of the day. Most have special speakers, events, entertainment, and holiday parties. I believe our ukulele players have performed at some of these communities, and I know some of you are listening today. The communities we will discuss include continuum of care, independent living, assisted living, memory care, board and cares, skilled nursing facilities, and special Japanese communities. This is a lot of information in a half hour or so. So we expect you to have some questions, and we hope we even have some answers. First, continuum of care retirement communities, known as CCRCs, provide the full range of options. They have independent living, assisted living, memory care, and nursing care in one physical location. Although different levels of care may be in different locations within that community, you're in one place. The idea is to provide for a person's lifetime as care needs change, while remaining in familiar surroundings and maintaining connections with other residents and staff. These communities usually are the most expensive and frequently require a buy-in. And the costs are so wide. So I just checked with a couple of communities. For one community, their monthly rents can run from $4,000 to $9,000 just for a studio, and $13,000 for a 2-bedroom. The buy-in can be from $54,000 to $600,000. That is quite a range. So what are the different levels? So there's independent living is exactly what it says. These are communities designed for the active senior, usually age 60 and older, where you have your own space, maybe an apartment or a single family home. Different communities offer different options. Each living space may have a full or partial kitchen. There are numerous social activities, entertainers, speakers, craft classes, organized transportation services, the whole bit. Again, depending on the community. Senior independent living is for the healthy senior who no longer wants to deal with daily tasks and home maintenance. For the senior who wants more social contacts and activities. There may be a monthly rental fee, home ownership, or a combination. And while you may hire personal caregivers, the community does not provide any personal care. Unless you live in a continuum of care community, where you then would move to assisted living, you must move if your care needs exceed what your own caregivers provide. There are a couple, not many that I know of, that are only for independent living. So by continuum of care, this gets confusing, while continuum of care starts with independent living and then will move to assisted living, etc. Some are only for independent living, and then you move on as your care needs change. Next is assisted living. I don't see the slide, so I'm not sure what comes to. There it is. Sorry. Assisted living is same as independent living, but also provides personal care in a residential setting. The level of care depends on the individual needs. There is an assessment process prior to moving in, and this determines the level of care at move-in, which changes and needs as your needs and abilities change. Care can include those ADLs, activities of daily living, including assistance with personal, I missed my page, hygiene, dressing, eating, mobility assistance, continence care, etc. It also includes medication management. There is usually a daily calendar posted with the menu and activities of the day. A good assisted living home will provide a range of activities for the range of interests and the range of abilities of the residents, from chess and book clubs to exercise and bingo. An assisted living community may or may not provide nursing care. They're not required to. One community I spoke to has a house doctor and a hygienist who come in on a regular basis. However, they are covered by your personal insurance. The basic monthly range, one community's basic range is $4,800, another's is $8,000. Plus, there are additional charges as care needs change. They all seem to have a move-in community fee. The one I checked with was approximately 2.5 times of whatever that monthly rent was. So obviously, talking about fees and costs are an important issue when you're investigating different places. Miyuki?
Okay, so I'm going to talk about board and care home. The difference between assisted living facility and board and care home is their size. When people mention assisted living facility, usually it indicates a bigger facility, while board and care is small facility, usually with 20 or fewer residents. Over time, people started using board and care to start referring to the small 6-bed and smaller places. There are licensed places. When you look for board and care home, ask owner if the facility is licensed. This is important. So rooms may be private or shared. Residents receive personal care and meals and have staff available around the clock. Nursing and medical care usually are not provided on site. Assisted living facility provide many activities, class usually as Veta mentioned, but board and care may not provide many. When is a board and care home the right fit for a loved one? Board and care homes for seniors may be a better fit for loved ones who prefer cozy, intimate, and home-like environment. Veta will talk about memory care facilities.
So memory care communities are designed and only providing memory care. So what I'm saying is there are some communities that are only memory care. They don't have anything else. But most assisted living communities also have a memory care unit. And remember, a continuum of care unit community has everything. So regardless, if a memory care is offered as part of continuum of care or assisted living, or is exclusively a memory care community, they are all designed for the needs of residents with Alzheimer's or dementia or other memory issues. They have a secure area To prevent residents from roaming or leaving unsupervised, they have unique design features to help orient residents and reduce confusion and stress. The outside spaces are closed, doors have alarms, and elevators have codes. They provide 24-hour care, and staff should be specifically trained. Unlike independent or assisted living, memory care units provide structured environment and set routines. One assisted living community I spoke to has 24/7 nursing care and memory care, but not in assisted living. Example of costs, $12,000 for a shared room, $15,000 for private. Unlike in assisted living, where charges can change depending as needs change, in memory care community, the monthly fee covers everything except incontinence care, which could add up to $500 or $600 a month due to more extensive supervision and costs of supplies. It's yours, Miyuki.
Okay, so I'm going to talk about facilities with Japanese language capacity. So there should be more Japanese care facilities in Bay Area, which is not included in this list. This list is just some examples. South Bay and Peninsula area may have more facilities for Japanese-speaking people. So some information is yeah.
Next slide.
Something problem with the computer, so it's just thank
There you go.
Yeah, the first one, J-Sei home. It's we J-Sei owns a care home in Hayward, and next one, Wagaya assisted living in El Cerrito. Then third one, Umenoki Garden senior home. So I'm gonna explain about the Umenoki Garden, which is kind of unique one system. As an independent living arrangement for the elderly, Umenoki Gardens is exempt from the state community care licensing regulations, which means that it is not a facility. It is a private residence of each tenant. Therefore, under the Alameda County Social Welfare Program, residents may receive in-home supportive service from the county that are only available to those who live in her own home. Residents and their guardians become household employer of the Umenoki care providers. Thus, each guardian is responsible for supervision and provision of care for their respective resident. Due to COVID, no shared room available at Umenoki Garden at this time. So this time, only 9 beds at this time. To look for in-home supportive service worker for Umenoki Garden, they can support as much as possible. However, due to COVID, it is difficult to find in-home supportive service worker at this time. So it may need to rely on private pay. I will talk about Kokoro, the fourth one in San Francisco. Kokoro is non-profit assisted and independent senior housing in community. And Kokoro apartment vary in size and price, as Kokoro is a non-profit public corporation that is tax exempt under Internal Revenue Code section. Kokoro offers discounted rate on 37 of the 54 apartment units set aside for low to moderate income persons. These discounted rates are available on a limited basis depending upon availability and your financial qualifications. And then the last, fifth one, the Kimochi San Mateo, assisted living, and sorry, Kimochi San Francisco, and also Kimochi owns the assisted living in San Mateo also. So I will talk about skilled nursing facility. So what is skilled nursing facility? Skilled nursing facility are sometimes called nursing homes or rehabilitation facilities and are licensed by the California Department of Health Service. There are some difference between skilled nursing facility and nursing home, but according to the California Advocate Nursing Home Reform website, most nursing homes in California are licensed as skilled nursing facility, which California broadly defines as a health facility, means medical necessary facility, and that has on-site licensed medical practitioner and that provides skilled nursing and supportive care. So people call skilled nursing facility also nursing home in California. The services are all services that include in assisted living, 24-hour skilled nursing care, as well as rehabilitation service, dietary service, social service, pharmaceutical service, recreation therapy, access to dental and vision care, emphasis on rehabilitation such as walking, ball bladder training, administration of injectable or IV medication. Most, but not all, licensed skilled nursing facilities in California are certified to participate in Medicare and Medicare. However, Medicare generally doesn't cover long-term care stays in skilled nursing facility. Medicare will pay for inpatient rehab for up to 100 days in each benefit period, as long as you have been in a hospital for at least 3 days prior. If you want to Medicare and Medicare help to pay for the nursing home care, you must select the facility that is certified by Medicare and Medicare. But if you stay hospital for 3 days and transfer to the nursing home for rehabilitation, usually hospital discharge planner check your healthcare insurance and find a Medicare certified skilled nursing facility for rehabilitation. So in this case, you don't need to worry about they accept Medicare, but if you look for by yourself, it's important. Medicare doesn't cover custodial care if it's the only care you need. Custodial care helps you with activities of daily living. I mentioned before, including like bathing assistance, dressing assistance, using bathroom and eating, or personal needs that could be done safely and reasonably. Average cost for skilled nursing facility in California is $9,247 per month, according to the the insurance company care survey. It's a green cost of care survey 2020. This is even semi-private room cost, not the private room. So Veta will talk about how to choose facility.
Sorry, I'm going to make up a little statement about how abhorrent it is, how expensive it is, but I won't do that. So, sneaky, huh? Okay, so let's just say that you've been looking at a few communities and they all seem nice, okay? How do you evaluate and compare them? CANNER, California Social Advocates for Nursing Home Reform, is an absolutely amazing resource. So you've got on the board their telephone number and their contact information, okay? They provide long and detailed lists of what to look for when you decide where to live. They break it down into assisted living and they break it down into skilled nursing facilities. The reality is that you look at them and a lot of it just makes a lot of sense. And regardless if you're looking for a continuum care facility or independent living, these lists are very invaluable. So some basics. Oh, and they have two basic lists. One is for practical, and one is for looking at the facility itself, and one is practical. How does it fit in to your life? So first, they suggest starting early before there is a crisis. That's how we started this whole conversation, and get a feel for the community. Would you be comfortable living here? Could you call this home? Does it fit into your lifestyle? While you want a pleasant environment, please don't be sold based on the attractiveness of the furniture, the structure, or the very pleasantness of your community advocate who's going to be walking you around. Be aware, how are the residents treated by the staff? As you're walking down the hall, do they say hello to each other? Does the staff know the resident's name? Do the residents know the staff names? How do the residents respond to the staff? Observing interactions in the dining hall. Are people friendly? Not just the community relations person, but the people who are relating and working with these residents on a daily basis. Visit several times, come unannounced at different times of the day and on weekends. I like to ask about the ratio of staff to residents. This does not include the executives or the office or the kitchen personnel. I'm referring to staff that interacts directly with residents on a daily basis. I also like to ask the average, and I don't even think this is on Canner's list. I like to ask the average length of time a staff person stays. Again, talking about the staff that interact directly with the residents on a daily basis, because your accountant could stay a long time. That's not who we're talking about. A person is most likely to stay in a pleasant working environment. And if it's a pleasant working environment, chances are it's a pleasant living environment. What about the quality of food? Does not have to be Japanese, but it is good and attractive, and is there variety? Food is a biggie. I've actually been talking to a couple of places that I interact with frequently to see if at least occasionally they could include an Asian entree or some Asian food on their menu, because there's always a variety. There's not just one thing, unless you're in a smaller board and care. So maybe once a month they could do Chinese, or maybe they could do Japanese, or maybe just some Asian variety. So in addition to this evaluation of the facility itself, and back up, there's always the smell test, okay? If you walk in anywhere, I don't care if it's a skilled nursing facility or if it's a CCRC, and this won't happen to a CCRC. If there's an odor, walk out, okay? There should not be that smell of urine anyway. I actually went into a memory care unit, a building that was just memory care, and there was an odor of incontinence. Are there people just hanging out in the hallway doing nothing? Shouldn't be. I don't care what facility it is. People should be talking to each other. There should be some activities besides a television. So in addition to this evaluation checklist of the quality dimension, that was the word I was looking for. They use the word facility. I don't like that when I'm thinking of someone's home. So I keep using community, but you may see the word facility. Just and your mind turned it around to community. Canner also includes this practical dimension checklist. Is the community accessible for family to visit? Wow, I just saw a great place in Fresno, but I live in Walnut Creek. How often am I going to go visit? That's an extreme, I know that, but it's an example of what I'm talking about. Is it someplace you can go and visit maybe to and from work, just stop by for a few minutes? Is it affordable long-term for your budget? Is it in a safe community to visit at night? Is there adequate parking? And then there's a whole list of financial questions and much more. Okay, this looks like a very nice community. Now, let's check for substantial complaints and citations. Again, go back to Canner. I love this agency. And by the way, if you call them, they are friendly and knowledgeable and helpful. And you never feel like you're being pushed off the phone, just like J-Sei. The Canner information, thank you for smiling, Jill, I appreciate that. The Canner information is on the slide. Of course, this information should be available from the community just for the asking. So, citations and inspections that are substantiated. A lot of people complain about a lot of stuff. We're talking about serious complaints and citations. Could be in the kitchen. Is the kitchen clean? Are the rooms clean? All kinds of regulations that every one of these licensed communities should follow. So I think
I'm going to talk about the placement specialist. So if you need help to find a placement, you can use placement specialist service. Placement agencies provide a free referral service to assist in locating licensed assisted living facility, boarding care homes, and memory care facilities. There are many senior placement agencies work with family. They can help to determine what type of care is needed and help to find the right facility. You need to share the information with placement agent specialist, including your budget, preferred location, condition of the person who needs a place, and any other needs you would like to share, such as language capacity, etc. Their service is free to family, as placement specialists get paid by the facility where the senior is placed. To choose placement agency, pick someone who knows the area that you are looking for placement. Use someone who is timely and responsive to your specific need. And you can research the placement agency by Google, but also we have the placement agency list. So if you would like to have the list, please feel contact me or Veta, so we can review the list.
so. One last thing, as Miyuki was talking, that I thought about is with COVID, some places are doing a virtual virtual tour. You know, that's great to know what the furniture is, but that is not going to help you know much about the community. You are entitled to see the community that you want to live in, or you want to, that your loved one is going to live in. And I will mention something that happened during a tour that I was with a client with. And I noticed that the person who was showing us around just opened residence doors of their rooms. And I just found that very disrespectful. And that's something else to look for. So they should knock. Your room is your home. It's where you live. I don't want anybody walking into my house without knocking first. Okay. Oh, just one more other thing. Whenever I'm working with anyone, however they find a place to live, if they're working with me, or if they're working with a placement agent, my clients, I ask them to let me know first so that I too could do a check on the community. If they care for me to do that. So before we go to Q&A, I want to thank Canner and Home for Mom, who were very helpful in my resources. And of course, we want to thank Jill, who makes all these special events happen. Now, if you can breathe and think of any questions, or we've been so thorough, you don't have a question to ask. Okay.
I thought
Go ahead, Dan.
I thought that your advice on not just leaving your review of the facility on a Zoom call, but to actually go to a space and feel it and see how the interaction and even the smell of the space is, and how you would really like to live there in that environment. That seems like a visit is the most important thing, I think, in all of this.
I like the word that you used, feel it, because that's exactly right. You have to feel it. This is going to be whole. Thank you.
Go ahead, Aiko, you have to unmute yourself. You have to unmute.
I can't hear anything.
Yeah.
What'd you say? Go ahead.
She's muted.
Can you unmute yourself, Aiko? I think.
Oh, we can't hear you.
Okay.
Or did you mute everybody?
I did, but I asked her to unmute.
We can hear Veta.
You have to unmute.
Okay, can
There
you
we
hear
go.
me now?
Yeah. Thank you.
Okay, so my name is Carol.
I'm going to ask you to speak up just a little bit louder.
My name is Carol Eichel, and my brother Dan is the one who just spoke. But I want to say that I was really impressed with this presentation. I thought it was very comprehensive. It covered all the possibilities, some that I didn't even think of. And I liked the idea that you could also contact a specialist to help you along the way, a specialist in particular that is familiar with some of the areas that you're thinking of moving into. I really thought it was excellent. I jotted down a lot of notes. Thank you so much.
Thank you.
Other questions?
Clarify?
Either we were so thorough you don't have questions, or we so confused you that you don't know what to ask.
I do have another thing. Even though the Ccrcs are at the top of the chain price-wise, some of the ones that are less expensive, it's not dramatically less. They're still expensive. Is that true? Did I receive that correctly?
Getting old and needing care in this country is not inexpensive.
Okay.
Depend on the area, like compared to Elcerito, Concord is more affordable, or also, depend on area, some price might be different. Even like, Royal, do you know Elcerito Royal? They have also Concord, I shouldn't mention the particular name, I'm sorry. But anyway, yeah. So even you find some assisted living facility, the big company, they have a several location, you can compare the price, compare the different location city. So they may have even same umbrella, same the company, but the price might be different depending on the location.
And sometimes, like, it may be a little bit more expensive at the beginning, but the increments So I go into a place and it starts out less expensive and that's pretty attractive, but the increments of increases happen more frequently and are sometimes so complicated to follow. They use a point system. You know, if they make it too complicated, they're not the only place in town. I also want to say, and we have been pretty good about not mentioning places, because mainly because we don't want to look like we're endorsing or recommending any places. Although honestly, we do have favorites, but we don't know there are hundreds of places. So we've been very careful not to mention places. Obviously, if you want to call us and talk to us about your personal needs, we will be less.
Okay, Vicki, you have a question?
I have a question. Roger and I both have been paying into long-term care. And I think one of the two ladies mentioned something about you had to meet 2 criterias in order to use your long-term care.
Yes, yeah. So it's better when you have a long-term care, please check your policy. If you cannot you cannot find your policy paper, you need to better to call your long-term care insurance to make sure when you can get paid and how you can get paid.
So contacting the long-term care would be a good place to find out what the criterias are for moving into assisted living.
No, go ahead.
So you question about the long-term care insurance, right?
Yes.
Yeah. So each person may have a different policy.
Yeah.
So I'm just talking in general. So so better to call your own long-term care insurance company. In advance, it's better so that you can have information before you really need to use.
Good idea.
Yeah.
So
Thank you.
Miyuki mentioned high cap. You did mention high cap.
Yeah.
So I have long-term care insurance, and I don't know if they purposely make these things so complicated or I'm just not very bright, but I called high cap I don't know how much you talked about high cap.
Yeah, high cap, if you have a long-term care insurance. Yeah,
so high cap health insurance, counseling, something or other, is a nonprofit agency, and you could call them. They help you with health insurance, understanding different health insurance. But I called them and specifically said I wanted to talk to someone who knew about long-time care insurance. Sorry, I'm old. Long-time care insurance, and I have to tell you, they were amazing. They asked for a copy of my policy. And they went through it. And then, of course, I called them back because I didn't quite understand something. And he was great. He was very knowledgeable. He showed me where I had something that I absolutely didn't need and where I was better off putting that kind of coverage somewhere else. So I strongly, a lot of what we do is give you resources.
That's good.
So
what would be the phone number for that high care?
High cap, HICAP. Jill is looking it up as we speak.
And also you need to contact your own county's high cap. Each county has a high cap office. So
right.
There were a couple of questions about the recording and also the presentation. I believe Carol put a link in the chat so you can refer to the presentation. So if you click on that, then you can look at it after this presentation, and all of the referrals are on there, and high cap is one of them.
Oh, great. High cap is on there.
And we are recording this session. We are also using a transcript, live transcript, which if you notice the notations on the bottom, they don't always get the words right. So we will review them and try and correct it, and we will make the transcript and the recording available for you in about a week.
Thank you.
And please know that we're both available.
Oh, good. That's good to know too. Thank you.
Definitely. Set up your own appointment, individual appointment.
Yeah. Miyuki, your extension is?
1111, and I think it's
Is it on there?
the paper.
It's on the
The
left.
la-
It's
last
on the
page,
last,
yeah.
it's on the last
Okay.
slide.
And there was a question from Kay on, does it make a difference if it's for-profit or non-profit?
What?
If a senior care facility is for-profit or non-profit, what the difference is?
Okay.
I can't hear him.
So
Evaluation check.
I think that, I said I don't know.
Oh, okay.
Well, J-Sei is definitely not.
Yeah.
I think they're for profit. I think they are, they're obviously for profit. Yes.
Yeah, I think it's
My guess, which is pretty educated guess, is that they are for profit.
yeah, I assume to maybe many of them should be the profit, but I mentioned like I explained a Japanese care facility, Kokoro in San Francisco, which is non-profit.
Right.
So clearly mentioned non-profit means probably I assume many other facilities are profit. That's why I think
Yeah,
they mentioned Kokoro is a non-profit.
it certainly explains their rates.
Does J-Sei have a written list of the evaluation checklist that you should maybe use as a guide
For what?
for evaluating facilities? As
Go
you
to
said,
Canner. Go to Canner, CANHR, you've got it. It's on one of the slides. And they have, I think they have one for nursing home and they have one for assisted living. But you could use it even for independent living because it's common sense stuff that we don't normally think about. So
Okay.
and as far as I know, by the way, I don't know if I mentioned this, this was half hour ago, long time ago. As far as I know, there's only 2 that are strictly independent, only independent living. One is the one that's out in Walnut Creek. What's the name of that? Rossmore is only independent living. And I think there's one in the city of Alameda, but very few are just independent. But it doesn't make any difference. The list is good for anything.
okay, thank you.
Can you spell Kaner or?
I just put it in the chat.
Oh, you did. Okay.
Oh,
CANHR,
Yes.
California Association
oh,
of Nursing Home Reform.
How can you advocate for nurse?
Probably there somewhere.
thank you.
California
Advocate
Advocates for Nursing Home Reform.
And I just put high cap in the chat as well.
Oh, here it is.
Thank you. I have it.
Okay.
I think William has a question.
Yeah, this is a comment I have. My father-in-law is 98 years old and he lives in one of these communities, and he has to be on a no or low sodium diet. However, his daughter, my ex-wife, checked and saw that he was being served the same food as everybody else. So they rode herd on the nutritionist there and got them to serve him no or low sodium food. So, you know, it really helps if you have an outside advocate, if you have somebody in one of these places to just ride herd on and see that they're living up to what they say they're supposed to be doing. If you don't have anybody, then it's too bad. And they're going to serve you high sodium food if you know, and whatever, because there's nobody there to speak in your behalf. Maybe J-Sei performs that for people. I don't know. That's a service that you provide to follow up with people that are in these places.
Yeah, if you have some help to advocate the right of the residents, also it's called ombudsman.
Uh-huh.
So each county had ombudsman.
Ombudsman.
And it should be listed visibly, easily to find in every residence. It should be a list for ombudsman. And if they have said that they're, but that's a good question. If you're looking for a place, which is obviously too late for you, Mr. Saito, do you accommodate different diets? Especially it's low sodium, because so many of us, as we age, that's an issue for us. So, and both Miyuki and I know how to be very nice bad cops. So if we can be of any help,
can you tell me a little more about the job, or what the managers that spoke today, what they provide?
Oh, yeah, we usually, of course, give this kind of community resource information for, but also we sometimes, as a people who registered as a case management client, we visit. The COVID, sometimes we had to difficult to visit, but when we're able, we visit the client for the assessment. And it's really depends on the client's needs. And sometimes if a client do not have any family member, but she had a long-term care insurance, but nobody helped to call the long-term insurance. And case manager, I call the long-term care insurance on behalf of the client. And also talk to the doctor on behalf of the client, if also the client agree. So it really depends on the individual need. And then Veta can also have more.
To piggyback, I want to say that I've had a couple of clients who did not even know they had long-term care insurance. They've been retired for a long time. They worked at the university. They did not know they had long-term care insurance. So if you've had long employment in a large company, you may have it and not even know you have it. And what we do is anything from people who need to go on Medicare and Medi-Cal and food stamps, all the way to helping, and Miyuki said, taking people to the doctor.
Usually meets at the doctor's office. We introduce some transportation information.
Right. So we try to do whatever you need.
Can we get a first and last name of both of you and a contact number?
I think it's on the last.
Yeah, I'll add it to the chat.
Yeah. And by the way, you want to mention that you see people with Japanese speaking?
Yeah, so I see, also mostly also doctor appointment, it's usually I provided people who has no family support.
And Japanese.
Yeah, and also Japanese speaking and memory impairment. So, and because it's, all the people, it's so hard to provide this kind of support. It's a very time consuming. And also I'm Japanese, my primary language is Japanese. So I also take the Japanese speaking people. And if please feel to contact me.
Somebody was asking, I think Bill was asking, when you mentioned low income in San Francisco, are you referring to 100,000? And is this true of other areas as well?
I don't know who you're talking to. I didn't.
Did one of you mention the criteria for low income when they were referring to low income? I think it's for Kokoro.
Oh. So I don't know. I cannot tell. I just saw the information through their website. So I don't know the low income criteria. And for low income to moderate income, their discount rate is limited. So you need to contact the Kokoro directly. So even some people who try to look for the price of the facility, I call the facility as a case manager, but they usually don't tell me the exact cost because they don't want to give a lot of information. They usually ask the client to call or client family to call them directly because they need to know more information about the person who need a placement.
Okay, and Donna has a question. Donna, do you want to ask your question? Or do you want me to?
Yeah.
Oh, not Kay, but Donna?
I can't hear.
Oh, you
Can,
can't hear?
can I,
Yeah, okay.
can I don't know if this is appropriate, but in your experience, Veta and Miyuki, how do people adjust to the transition from living in their own place to living in a assisted living or?
Kay, that would come from somebody who was a doctor, not just. Kay is a retired doctor. It's a good question. And it, the more, certainly it makes a difference whether you have decided to move for yourself because this is what you need and you think is right for you, than if you're moving a loved one or someone else. And one of the suggestions that in Canner, because I could not mention all of them, is that the person who's involved should be involved in the looking as well. So if I'm taking someone if I'm taking a loved one, that loved one should be involved in this process as much as possible. And that's why I look early, okay? Somebody's starting to get dementia, you're not sure if they're ever going to really need to move, give it a shot, look now. So that while they're competent or more competent. So moving, I don't know about you, but every time I move to another house or another apartment, I'm adjusting and they're adjusting. So the more support that somebody has, the better off it is, especially someone who's going into a memory care unit. I mean, they really need to have somebody there frequently. After a while, you don't have to come maybe every day, but certainly for a while, we all need as much support as we can get when we're moving into a new environment. And we can stress the pluses, you don't have to make food anymore. You're going to get good food and look at the people around you, and you're going to have community, and you're going to have bingo, or you're going to have exercises. So trying to emphasize the pluses. Is it going to be hard? Absolutely. Is it going to be beneficial? Certainly, that's the idea. Does that help, Kay?
Yes.
Thank you.
And
Good
also,
question.
yeah, thank you. And also some facility you can ask if they can accept the short stay for tryout, 2 weeks or depend on the facility. Okay, we have a furnished room. You can try for 2 weeks, and so you can ask them if they can accept short stay for tryout.
So Miyuki and Veta, how do you deal with if you're dealing with a couple and you have the man that's making all the decisions and calling all the shots, and the wife hasn't had a chance to express herself? How do you deal with that?
You don't want to know how I would deal with that. Let's put it this way, it's not in my experience.
Okay.
No, I hear it as a serious question. I guess one of my questions is, why is one person making all the decisions? Is it cultural? Is it that somebody is feeling like they're not listened to? So I think it would depend on the situation. If it's cultural, if it's Japanese cultural, I would suggest my partner might be a good person to intervene and to talk to the family.
Or divorce them.
What?
Yeah, divorce.
Or divorce them.
Yeah, well, been there, done that. Did that answer it all, Dan, what you were asking?
Yeah, thank you very much.
Yeah, it's really dependent on the most important is how each people are comfortable with this kind of style. So both sides okay, or both one has a wife or husband has a problem or a complaint, then it's need to discuss. And
Yes.
And also look for the assisted living. It's maybe sometimes good time just along with a partner, assisted living, and so it's about. It really depends. Yeah, of course, it depends on the couple, but their decisions and family decisions.
There was another question. I think Miyuki, you mentioned it's good to get long-term insurance at a younger age. If somebody is 70 and they don't have long-term insurance, do you still recommend or?
Yeah, that's as I mentioned, it's really challenging because it depends on your medical condition and your age. So you can try, but your monthly premium maybe end up very high, or even the long-term care insurance may decline your enrollment. So yeah, I cannot say yes or no, but it's really, you can just try, but there's no guarantee you can get the long-term care insurance.
And like everything else, it can get very expensive.
Yeah.
I pay almost, not quite, something like $275 a month for my long-term care insurance, and I've had it for a long time.
And you have to continue to pay until.
Well, I certainly can't give it up now.
Until you need it, right?
Right.
Yeah,
I mean, this is when I'm closer to needing it. So, you know, it's sort of like automobile insurance. You got to have it. You don't ever want to use it.
Okay. Are there any other questions or comments?
Thank you so much for your attention and your questions.
Yeah, you got a lot of thank yous in the chat. Thank you.
Yeah.
Very helpful information.
Thank you.
Thank you.
Thank you. Thank you. Thank you very much.
Thank you so much.
Thank you.
Thank you.
Thank you.